of state cannabis programs across the country, and then have a kind of a close-up look at Colorado. This room must be full of Lutherans. Everyone's in the back. Feel free to load the front. That's good.
And we're leaving at noon.
Yeah. Yeah, there's football on somewhere. Welcome to everyone. I'm Karmen Hanson. I'm a program director at the National Conference of State Legislatures. We are a bipartisan organization of all 50 state and territorial legislative bodies. Again, we're bipartisan. We do not take any position on state policy whatsoever. We look at everything just from kind of what are states doing, how are they doing it, and we give information to other states when they have questions. We're basically backup researchers for the 50 state legislators, of which there are 7,383. He's one of them, Representative John Singer from Colorado, who's going to be giving kind of the part 2 to the presentation. NCSL, we are located right here in Denver. We got a nice office just east of downtown. It gives us the ability to be in mountain time and not East Coast, so we can serve the entire range from, Palau, from all the far way east in Guam, all the way to Maine. So that helps us serve the country better. So we're going to do just an overview of how state cannabis laws, both medical and adult use, and just a disclaimer, I'm going to use adult use, retail, and recreational pretty evenly. I generally use the words adult use or retail because just kind of within Colorado we've gotten away from using the word recreational within like the Colorado Department of Public Health and Environment and other state agencies. We're just trying to keep it, like they said earlier today, kind of not fun in the recreational sense. So this is not a session about whether a state should or should not go ahead with any kind of legalization. As we've been hearing in the other sessions, we're kind of beyond the should states do it or not, because a lot of times it's forced onto the state policymakers because of the voter vote initiative. So this is this information is just kind of what states are doing, kind of like a mini history lesson. And how many of you were in here for the previous session? Dr. Butler, raise your hand. Anyone else? Okay, some of their overview information was excellent, and some of their detailed information was even more detailed and up to date, I might add, than some of the information in my slides. So I would highly suggest you refer to the previous session, the ASTHO, CDC, other state folks that were in here. They had really good information, so check out their slides. Okay, so the state legalization of marijuana and cannabis, two other words I'm going to be using interchangeably, started back in California in 1996 with a ballot measure. And other states, mostly Western, also legalized medical use by ballot initiative, which is a more common practice in Western states than Eastern states. States began legalizing medical use via legislative measures a few years later, and now all but 4 states currently have some sort of cannabis product access programs underway. The rest of my slides are just going to provide information on the variations in these programs. And another quick question, how many of you are from Colorado? Okay, how many of you are from a otherwise legal state? What about a medical state? Only medical?
Only medical.
Okay. What about a CBD only state? What about a nothing state? Okay, good. We have a good mix, so that's good. It's just helpful to know that as we go forward, because some of this stuff may be kind of old news for some of you in various states. So a quick recap of medical programs, just to help with the context of how we got to the adult use regulated market. Again, California was the first. After that, 28 states, DC, Guam, and Puerto Rico have followed. Most of those have been since 2000, making for a total of 31 existing programs. NCSL, we don't count Louisiana as like a full comprehensive medical program yet because they have a lot of limitations on THC access, no smoking or combustible smoking of flower product, and that's just one of the that's one of the qualifications we use to determine if a program is CBD only or low THC versus a comprehensive medical program. So 16 of these programs were voted in by ballot initiatives, 13 were approved by legislative bodies. And not all of the approved programs have been fully implemented as intended. It can take anywhere from 6 months to 24 months to get the program up and running, and that just depends on the process set up in each state. And I've provided a link here on this slide to my NCSL medical marijuana webpage, and that's just a good resource page. You can also just Google NCSL and marijuana, and you'll probably get one of my 2 web pages. And most of the information that I have on medical is taken from that website. So as we've been hearing, no 2 programs are alike. Most have some similarities for sure. Most programs include provisions for the following issues, things like patient registries, grower and caregiver registries. There's definitely limits on plant counts that we've heard, anywhere from maybe 3 to, Colorado had the 99 rule there for a while, but that's been dialed back. Dispensaries, some states allow for medical dispensaries, some states do not. And then the types of conditions that someone needs to qualify for a medical use card, that can also vary. And some of the states do recognize patients from other states. There's like a handful that do that. Product testing also varies widely. It's not something that's typically set up in enabling language by the legislature or by the ballot initiative or legislative measure to create a medical program. And the most recent states to approve any kinds of programs in 2016 and 2017, their details are kind of yet to be determined. Often it can take 6 months to 18 months or more. And those types of details do change quite often. And let's see here, the next slide has some of the other history here is that the latest thing within medical programs are the low THC programs or the limited research programs. This came up in 2014 and 2015 for the most part, and it's of growing interest in states that people want to look at the use for children, epilepsy, some of those very serious conditions that sometimes there isn't a current pharmaceutical product that's meeting their needs, but it's not a full-blown, quote, medical marijuana program. 17 states passed these bills in 2014 and 15, and again, they also vary. Idaho was vetoed by the governor, so they're still on the nothing, no type of access state. And again, more information on these can be found on my website page. So here's just some more background. I don't want to get too caught up in the weeds on CBD programs just because they're really limited. Most of them aren't functioning quite well or functioning kind of at all. A lot of them wanted to have in-state access, but they haven't found a way to create the in-state access, or they're more like saying, if you get caught with this product in our state, you have a medical defense once you get to court, but you're basically at your own risk of breaking a federal or a state law by getting the CBD product out of state. So they're not fully functional, and they're just quite tricky, to say the least. And like anything else we've been hearing at this conference, the medical use of marijuana has its advocates and critics. That's probably the biggest understatement ever. But shortly after California legalized medical use back in '96, the Institute of Medicine came out with their own opinion. This was the first go-around, not the one that just recently came out. But it found that marijuana helped some patients with pain relief, and any side effect was generally short-lived and well-tolerated. In late 2012, the Treatment Research Institute released its own opinion based on its addiction-related research, and they do not advise using marijuana for medical use. And in more recent years, various disease-specific and patient advocacy groups have varied in their support for medical use of marijuana for the treatment of pain, nausea, and other issues. Some groups that may not currently support its use might with additional FDA and scientifically rigorous research. Folks like ASAM, American Society of Addiction Medicine, American Cancer Society, Glaucoma Foundation, the MS Society, and American Medical Association. And some of those groups will not agree to like a full legalization support, but again, that's kind of a whole other issue. And again, as we've heard over and over, as federally is a Schedule I product seen as having no medical acceptable use. However, this is also bringing up the Ogden memo, the Cole memo. The feds have kind of, back in the previous administration, said they would not enforce those federal laws in those states that had medical and adult use programs. And let's see here. And the million-dollar, probably multi-billion-dollar question is probably more accurate, is that we get asked all the time, what are the feds going to do? Well, NCSL is a big federalist states' rights organization, so we would happily work with the federal government on this and come to some sort of updated poll memo or something like that if the feds would like to sit down. They have sent, AG Sessions has been out to Colorado and Alaska, Oregon, and Washington, I believe, to speak with those regulators and get some additional details before they come out with a new opinion, but we'll have to see how that goes. And there are other organizations for sure that have more gathered data on who supports and who doesn't support some of the medical use. Groups like Project SAM, Smart Approaches to Marijuana, they have a lot of pretty rigorous scientific research and support for those efforts. And that's generally kind of the history of the medical side of things. So we're going to do a couple minutes here on legalized adult use. In 2012, 2 states legalized small amounts of marijuana for adult use, often called recreational use. That's Colorado and Washington. Colorado's Amendment 64 and Washington's Initiative 502 both passed by popular vote. Colorado's governor appointed a 24-member task force to come up with the rules and regulations for the law. It included 4 legislators, members of the Public Health Department, Department of Revenue, and the governor's chief legal counsel, among others, who are also industry folks on that original task force. They announced their comprehensive recommendation report in March of 2013, and sales started January 1st of 2014. And we, ever since, and Representative Singer can attest to it, we have been a revolving door of visiting states ever since with other interested regulators or state legislators coming in, public health officials coming in to see what Colorado has been doing, how it's going. It's a constant state of requests around here. And real quick, Washington State uses their state liquor and cannabis board to regulate. Alaska has their alcohol and cannabis board as well. And Oregon uses the Oregon Liquor Control Commission. And DC, again, they're that kind of weird animal that just doesn't care about the regulation side of things, so they don't really have an overseeing body except for their medical program. And for the more recent 4 states that just passed in November, California, Maine, Massachusetts, and Nevada, they are now just starting to come online with finalizing their implementation details. So to wrap up some of the other significant pending legislation from 2017, most states are out of session right now. I think there's only about 6 that are either in regular session or in special session. These are just, I've put the ones in red that have already died or did not pass committees, and the green ones are either passed and then the blues are still pending. The 2016 ballot initiatives, Arizona did fail at the ballot box, but it was pretty close if I remember. I think it was 52% failure on that one. And there's significant legislation across the country in all of the states that have programs to make improvements or tweaks to the programs. And there's also a lot of legislation on decriminalization of marijuana and other kinds of penalties, and those aren't related to adult or medical use. And my colleagues in our criminal justice program follow those much more closely. So far, all of the adult use legalization efforts have come through that ballot initiative process. While not all states have that process, it's important to note that the legislature has still played a very important role in the medical and adult use regulating programs in those states. Legislators are drafting legislation, regulations, or enabling language in response to the ballot initiatives, and some have direct oversight of implementation and evaluation of programs and procedures. Some of the most important areas of regulations established by legislators are the establishment of fees, tax structures, and enforcement or regulation funding. Oversight is typically assigned to another state department like public health, revenue, or another state agency. And as I mentioned, many of those states allow localities to further regulate or prohibit cannabis-based businesses and operations within their city or county limits. And there's just a quick, another version of oversight and who's responsible for the regulations. Colorado has it generally is housed within the Department of Revenue and our Marijuana Enforcement Division. Again, Washington is the State Liquor and Cannabis Control Board. And another similarity between all 8 of the current adult use programs, It's all for adults over age 21, and it has there's more variations than there are consistencies with possession, cultivation, methods of purchase, facility limits, licensing fees, all those other details that we've been talking about this week. They all vary pretty widely. So here's just an example. It's probably easier to read this when you pull it up and download it, but this is just some information from various sources that tracks the specific details of each state's regulations, just in some kind of key areas where I get a lot of questions. And you'll see some similarities. These are the original 4 states, and most of the variance in these 4 states can be seen in tracking and security issues. And I can say from Colorado's experience, the testing and tracking of products has gotten much more specific in the last 2 years since the industry started back in 2014, and it's now expanding into the medical side production as well. We didn't have medical testing before adult use started in Colorado, but there are also more discussions about local limits, licenses and types of licenses and procedures than just at the state level. So this is just kind of the highest level of state level regulations. And from what I've understood from knowing Colorado's experience, Washington has kind of gone through the same procedures with testing and packaging as well. And this slide is basically the same categories but the new states, and this is just what was currently known or what was last known or understood. Again, information in these categories can change pretty quickly, so I probably look at this slide a couple times a month, and it can change almost weekly. And additional rules and regulations are provided by the agencies or the legislature, and like I said, these are just a small sampling of some of those areas. And some of the differences with these more recent states compared to the original 4 is that some allow for larger personal possession and include a different purchase limit for concentrate products, something that Colorado does not have, something that the original states didn't necessarily include at the start. Here are a couple basic observations on tax and revenues for each program, and I get this information from a lot of various resources. Actually, right now we have Pat Oglesby here in the room he's from North Carolina, but he's a tax guru on cannabis products, so if you have a tax question, he's your guy. You want to corner him before you leave today. And this is just a quick overview on the mostly Colorado slide right here. And tax collections in both Colorado and Washington did exceed their initial estimates, and it's estimated that nationwide implementation could raise billions of dollars a year. Another thing is that for Colorado, Washington, and Oregon, they all kind of reduced their retail marijuana taxes a bit because they were really concerned with too much tax not pushing out the black market as much as they had anticipated or would have liked to see. So most of them have adjusted their tax rates down in most cases. Tax rates on retail sales have been the easiest to implement. Wholesale taxes, transfers on whole flower products and seeds, things like that, or THC level is much more difficult to implement. It's not impossible, it just can be more difficult. And it definitely takes time for these tax systems to establish consistent reporting and tracking. Definitely don't underestimate the role of health, agriculture, zoning, local law enforcement, and criminal penalty issues. They are largely unaddressed in ballot initiatives and are left for the implementation process. And just a little teaser on some of the Colorado information. Only a third of Colorado's counties allow for medical or retail production and sales in unincorporated areas. And it's about the same balance, plus or minus 1 or 2 counties on that. So when people say, pot is all over Colorado, it really isn't. It's just kind of concentrated in our urban areas where 80% of our population is. So it pretty much follows the population curves. Colorado has a 15% excise tax, which goes to the state who funds the $40 million school improvement grant fund, and 10% of the special sales tax is the other amount that funds other efforts, which I'll review on the next slide, and Representative Singer has a lot of information on that. Medical products are not subject to the 15% tax rate, but they do have state and local sales taxes. And early on, Colorado had $1.3 billion in sales, which resulted in roughly $200 million in tax revenue. That's, I think, from the first year of sales. And per a recent Colorado Legislative Council report, this was how the first batch of tax money was spent. Again, Representative Singer can correct me if I'm wrong on any of these things, but this is just a quick kind of breakdown. And just a little explanation on this. When Colorado voters first approved adult use retail, the measure dedicated the first $40 million of excise revenue to school construction, and that is in our state's constitution now. And to facilitate this, the General Assembly referred a 15% sales excise tax to the voters, which for that $40 million, and it's used to renew or replace deteriorating public schools on a competitive basis, and it's awarded annually. A lot of people hear that Colorado's funding their schools with pot money. Not really. But it's a very small drop in the bucket for the overall funding education. So in 2014, the legislature here created the marijuana tax cash fund, and this is where other sales and special sales tax goes. It has to be spent the year after it's collected and is used largely for healthcare, education, substance abuse prevention, treatment, regulation, oversight, and law enforcement. In 2015, Colorado made headlines reporting nearly $1 billion in cannabis sales. That translated to $135 million in taxes and fees, and more than $35 million earmarked for schools. And Colorado is now fully funding that $40 million promised to the school grants program. And nearly twice as much product is sold on the retail level than the medical level. And here is another quick overview of Washington. Again, Rick did a great job with his slides this morning on Washington, so I would definitely refer to his slides if you want really recent data on Washington. Washington State has a 37% excise tax on all product sales collected at the point of sale. Their first 12 months of sales was roughly $257 million. Taxes on that were about $64 million. And according to the legislative fiscal note from the Washington legislative staffers, this was the breakdown on how the money would be spent. The Washington Basic Healthcare Fund and their general fund received the largest portions of their revenue, with other prevention and education efforts receiving the remainder, and of course, program administration. That's one thing. In Colorado, our enforcement is pretty much taken care of by fees and licensing, application fees, licensing fees, kind of funds our marijuana enforcement division, but they do get some money through other sources. And Oregon has less of a track record to analyze, but here's just an overview of their tax methods. They have a temporary tax on adult use sales by existing medical dispensaries. They're still ramping up their retail program now. It's 25% at the point of sale to the customer. For retail dispensaries, the tax is 17%. Localities are allowed to add another 2%. There will be an estimated 350 licensed adult use retailers in the fiscal year, up from 550 in the next few years. And the revenue collected in Oregon will cover administrative costs, school funds, behavioral health services and treatment, law enforcement, and the state health department. And localities will receive funding based on population. However, areas that do prohibit the sale of retail products won't receive any of the marijuana tax revenues. So Alaska is the last program to become operational of the first four. It is still early. Again, Dr. Butler had a great presentation on Alaska a few minutes ago. And I'm really embarrassed now because if any of my numbers are off, I'm going to feel really bad. But their sales started in late 2016. The Marijuana Control Board, which was set up shortly after their legalization, was passed and adopted regulations that were effective in February of 2016. And those related to packaging, store locations, distribution, edibles, and social clubs. The license application period began early in 2016, and their marijuana industry's inventory tracking system started shortly after that. Their ballot measure 2 set a $50 per ounce tax on marijuana paid by the cultivator when marijuana is transferred to a retail store or product marketing facility. And at the going prices of roughly $250 an ounce, that's an Anchorage estimate, and that would be about a 20% effective tax rate. And let's see, the State Department of Revenue estimated that their tax revenue would be between $5 million and $19 million a year, with regulatory and enforcement costs between $3 and $7 million. And time will tell what this all looks like, but this is just based on some of the early estimates. And then there's Washington, D.C., which is kind of the odd duck of them all with adult use. So it looks like none of the other states, they don't really regulate production or sale because they do not have a regular retail market. And it's also complicated just because of congressional oversight. And there is a certain Maryland congressman who was not supportive of Maryland's marijuana legalization. and he inserted an amendment into a federal budget bill prohibiting DC from using any federal or local funds to, and this is the quote, to enact or carry out any law, rule, or regulation to legalize or otherwise reduce penalties associated with the possession, use, or distribution of any Schedule I substance. So this makes it nearly impossible for DC to create a regulatory or tax structure for commercial sales. One estimate claimed that DC could generate around $20 million a year if they had a regulated tax system. And there will be no additional comments about the federal government and the ability to raise taxes on marijuana sales. And so here's just a quick overview of the currently proposed tax rates and oversight agencies in the newer states. California will have a cultivation tax of $9.25 an ounce for flower, $2.75 for leaves. Consumers will pay a 15% sales tax. Buyers in Maine will pay a 10% sales tax, and Massachusetts taxes include a 10.75 sales tax, excise tax, 6.25 sales, and that's an additional 2% for local. It roughly is about 20%. Nevada has a 15% excise tax on wholesale sales, and again, oversight is varied and is housed with various agencies in the new states. So those are just kind of the high points, pardon the pun, with the presentation, and here's just a couple other questions that we get asked a lot of at NCSL. And one of them is about diversion. How much diversion is there out of adult use or medical programs? As we've been hearing all conference long, data lacks in a lot of these areas, unfortunately, and it's very hard to calculate. There's little pre or post kind of program information available. One of the very early Colorado studies with the medical program said that 70% of kids who reported getting product from someone said that they had gotten it from a medically qualified person or a source. It's assumed any of the adult use product that does get into the hands of kids is, or it could just be grown at home now too, so that number has definitely, most definitely has changed. Research is currently underway here in Colorado on the social implications of our program, and Colorado recently reduced the number of plants grown on behalf of medical patients by caregivers, the idea being that this will limit some of the less tracked cannabis grown from hitting the unregulated market, which is not tracked seed to sale. And again, there's just a link there of the different organizations who support or do not support medical use of cannabis. And again, there is no kind of one comprehensive list out there because some of them don't necessarily make it public. And the other big thing I'm asked to do is prognosticate on which states are going to be the next to do anything. Luckily, I don't have a crystal ball that will tell me that. And so if I did, I'd probably have a 1-800 number and be making a lot more money than I am now. But right now, all states are with existing programs have bills to make changes to their programs. I'd say every year there's about 10 to 12 states that have a serious piece of legislation that someone's put forth to do an adult use regulated market, but most of the time they don't catch a lot of traction. And here's just a quick list of some of the NCSL resources we have on this, and I'm happy to, if you want to see me after with other questions, I'm happy to take those as well. And that's the quick overview. Maybe not so quick, but that's the 50-state overview. And now we're going to hear from Representative Jonathan Singer from Colorado. He represents House District 11, which is largely Boulder County, in part about 45 minutes or so north of Denver. And I know his area very well because it's where I grew up. So he's also the current chair of the House Public Health Care Committee and Human Services Committee, and he's the vice chair of the Joint Technology Committee.
Different joint.
He's the pun king, I'll warn you now. So I'm just trying to transition you slowly here. And he's a social worker by profession, so he definitely has a key interest in the social and health implications. And he's been a key sponsor and lead on the legalization and regulation legislation in the Colorado General Assembly, and he'll give you an overview in more detail of Colorado's experience. And I'm just going to do a quick little presto change over here, and then he can start. All right. There we go. All right.
Thanks, Karmen, and thanks for all of you for being here, not only for being here in this room, but for coming to Colorado. I hope you've got the chance to come out of some of the windowless rooms and actually enjoy our beautiful Rocky Mountains. And Karmen and I were just talking a little bit earlier about, a couple of rules of thumb for all of our out-of-town guests. Do drink lots of water. It's always a good idea, but it's especially a good idea at high altitude, and never eat the whole brownie. So that was Karmen's joke. So I, like Karmen mentioned, I represent northern Boulder County. Now, for a lot of you who may know something about Boulder County, we tend to be a pretty progressive county. That being said, my district, just in terms of partisan affiliation, for those of you who care about those things, it's 34% Democratic, it's about 36% Independent, and about 29% Republican. So it leans blue, but it's certainly by no means, an example of a liberal bastion like the city of Boulder or Berkeley or something like that. So when I go out there and I talk to my voters every couple of years, what I do is, ask them what's on their mind, and inevitably marijuana comes up. And it's interesting, in my city, in the town of Longmont, where we have 90,000 people, we have not only apparently a history of banning things. We were one of the first communities to ban fracking. We also have a city ban on medical and recreational marijuana dispensaries. And the interesting thing, in 2012, when this was on the ballot, I got a question. I would get these questions about marijuana, and there was this bell curve. About 2% of the community would say, Jonathan, what do you think about this? I'd say, well, I think it's pretty lousy that we actually have a system where we have money going into the black market when we could be spending money to invest in the things that we all care about. And they go, oh, okay, I'm on board with you. We could literally disagree on everything else, and that about 2% of the folks that agreed with me on that issue didn't matter. School vouchers didn't matter. It was marijuana for them. There's another 2% that said, I told them the same thing, and they would say, yep, we could agree on everything, you lost my vote. Okay. Then there was this soft but large, sizable middle that really didn't care where I stood on marijuana. They cared about all those other issues. Fast forward 2 years later for re-election, instead of the debate about legalizing and not legalizing, kind of like you heard about in the keynote speech, it was much more about actually, well, what's going on? I hear about edibles. How are you going to regulate those? Banking, what do you do about that? I mean, actually really thoughtful questions. I think they all sort of regretted asking me those questions because I'm one of the prime legislators for all of those things, so I don't know if I ever stopped talking about it, which is more fair for here, less fair for my constituents at their door. So I apologize for some bug infestations and some lost pets. 2016, fast forward another 2 years. Now the question is, well, I see all this revenue, but I know our town's not getting it because we don't have legalized dispensaries. I know you're not on city council, but isn't it about time? And I said, it's high time. So, that's the proliferation of puns. Probably the worst part of this. So I'm going to give you even a faster overview because you've heard about this, but I want to talk about some of the things that happened right in 2012. What was interesting is a lot of people assumed that Election Day, marijuana was legalized in the state of Colorado. Well, for the rest of us wonks, we know that's not the case. Just because a constitutional amendment is passed doesn't mean it's actually enacted. And so the governor, either snarkily or wisely, decided to issue an executive order to ensconce this in our Constitution a little earlier than normal, but announced it on, I don't know, like a Wednesday at 2 o'clock in the afternoon. And so anyone who was planning on a big party had to literally run up the Capitol steps, do whatever kind of celebration they decided to do, and run back down. The governor was not a supporter of this. And when it passed, he said, don't break out the Cheetos and Goldfish just yet. So here we are. Here's the other thing, though, that he did right. He said, look, 55% of the state voted for this. They decided to put this in our Constitution. Actually, over 55% of the state. More popular than Barack Obama in Colorado. So he said, we're going to lean into this. We're going to create a task force that includes everybody. DAs, defense attorneys, soccer moms, NASCAR dads, medical marijuana patients, dispensary owners in the medical marijuana industry, regulators, police officers. Everyone, come to the table, come together, and figure this out for us. Create some recommendations for us. Well, they came out with basically a phone book worth of recommendations, 58 recommendations, not 58 pages, unfortunately, in 17 different categories. But the takeaway that I want you to have from this slide, and I probably should have left this in a bullet point, close to 90% of these recommendations were unanimous or very close to unanimous. And this is what's important, because we've reproduced this process every time a new rule or regulation or law comes into effect. We have these public meetings, these public hearings, and we invite all comers, because this is a new cutting-edge topic. And we're going to have some uncomfortable conversations, but if you want to create a policy that actually stands the test of time and works, then you want to bring everybody there. And so it's when people say, what's your tax rate? What's your rule on packaging? What's your rule on labeling? Those are important. But how we got there is almost more important, because we invited everybody to the table, and even if people disagreed, I hope that most people feel like they got a fair say in that process. We did actually have a joint committee. It was called a joint committee because it's half House and half Senate. It has nothing to do with a pun, but the Associated Press did dub this the joint committee. These were our guiding principles. And if I could sum this up in one sentence, it is that we want to treat marijuana like the drug it is, but not the drug that some people have made it out to be. So let's talk about the facts. Let's talk about the way that marijuana actually is, the drug it is, but not the way that some people fear it to be. So, we put a tax, and apparently other people thought of this in 1937 with the Marijuana Tax Act. So, but the reason I put up this slide, and the reason I used the taxes and smoke-filled rooms, is that even though Amendment 64 legalized this, because of the way that Colorado works, we had to refer another measure to the ballot, to the voters the following year to say, yes, we understood that you wanted this legalized. Yes, we know that the first 40 million should go to school construction. But we actually have to ask you again, because that's also in our Constitution. It's not something I recommend, but it's something that I mentioned. There was an effort to scuttle this bill and actually relitigate the legalization of marijuana. From a big picture point of view, we have 100 lawmakers between the House and the Senate in Colorado. There were 2 that publicly supported Amendment 64, myself and a Tea Party Republican from the suburbs. So the upside is now I'm friends with a Tea Party Republican on Facebook. The downside is he was term limited. And so when this passed and I came back, he did not come back. And so it was largely up to me and a group of lawmakers that either were quiet on the issue or that opposed the issue that came to this. So this is literally a picture, I believe, from the Denver Post of a bunch of lawmakers gathered at about 11 o'clock at night trying to decide whether or not they should scuttle my bill and put another issue on the ballot saying, should we have a tax? And if the tax fails, should we make the sale of marijuana illegal again in the state of Colorado? That initiative failed, my bill passed, and now we have a bunch of money. So I know this might be a little small for you to see, but just to give you an idea of the total number of medical and retail dispensaries, cultivators, all that, 1,500, including centers, cultivators, infused product manufacturers. We have over 1,500 licenses in medical, and close to about 1,500 in recreational. The tax actually just went up this year to 15% on the sales tax side. That was to help actually solve a major budget problem where we were going to be closing numerous rural hospitals. But once again, I'm going to give credit where credit is due. This is the gray slides, which of course look more boring. The reason they look more boring is because they were created by one of our analysts in the Office of State Budget and Planning. And so I'm going to give her all the credit for the numbers. They are accurate, but they are just not my slides. So let's talk numbers for a second. Let's talk the big numbers. So $88 million in the first year between the tax on medical, excise, retail, as well as the special taxes. 2017 projected $281 million across the board, including medical, excise on recreational and the special sales tax. This does not include the special sales tax or special excise tax that all localities are allowed to levy upon approval of their voters. So if the city of Boulder or the county of Denver or anyone else wants to put on their own tax, they are free to do that. There are no caps. Actually, that may be changing, but there are no current caps on that. But most cities have been pretty responsible, putting in somewhere between a 1% and 5% tax. Just in case you thought this saved our state budget, I like to actually show this to my constituents, because when I go and say, you know what, we have $1 billion in unfunded tax need for our roads, and another $1 billion, by the way, for our K through 12, and hundreds of millions of dollars for our higher education. They say, well, can't marijuana pay for that? And my favorite response is, well, how much marijuana did you buy last year? Actually, it was from another term-limited state senator who used that, and now we know why he used term-limited. But no, but that green slice, 2.4% of our overall state budget. That's it. So how does this actually work? One of the things, and the takeaway I want you to take from this, and I won't go into depth about this because you can look at this later on, is that we created our own separate tax cash fund for our marijuana tax revenues. The reason that we did this was several-fold, but this is the important thing. This could go away tomorrow. You know this. We know this. Jeff Sessions probably knows this. This could go away tomorrow. It could go away tomorrow because the federal government says it goes away. When the 6th largest economy, California, actually gets up and running with their system, I don't know how robust our market is going to be. We cannot reliably predict that. So the question is, are we going to funnel this into our general fund and use it to fund essential things that we have historically funded through more reliable revenues? Or are we going to try and do something different with this? So you heard a little bit about our best public school capital construction fund. The other one that we're doing with our special sales tax is going to a number of other things, which I'll show you here. So let's look a little closer at the marijuana sales tax for a second. We actually do fund about $30 million in our public school fund from marijuana. Now, once again, in a state where the city or Denver Public Schools has about a $900 million budget, how much of a difference does $30 million make? It's a lot. It's not going to save your bacon, though. So, when we talk about related programming, these are the key things that we talked about. And we try to hold true to what the ballot language was, which was when we asked the voters to approve this tax, we said, we will use this to fund the anticipated or possible costs related to the legalization of adult use or recreational marijuana. So whether that's youth prevention programs, we're actually not trying to prevent young people, it's actually youth prevention of risky behaviors, public health and safety, regulation and enforcement, which yes, a lot of the fees that we've created go to that, but we also spend some of the marijuana tax revenue on that, and then behavioral health treatment. Colorado has historically one of the highest addiction and suicide rates in the nation. That was before the legalization of marijuana. It hasn't changed. What has changed is we now finally have some financial resources to fight those things and create a better system. This is another way to look at this issue. So if you see that human services gets not the majority but the plurality of the dollars, but we try to spread the money around. And when you see the gray slide there where it says local affairs, $22 million, I'm not going to use the pointer because I'll probably just break everything. But when you see the local affairs dollars, our Department of Local Affairs is responsible for the distribution of local, city, and county grants. And so it's really not to pay necessarily for just any affair locally, but we distribute a good set of the money through that mechanism. And we'll talk a little bit later about that. Once again, this is probably too small for some of you Lutherans in the back, but the gentleman here is not pointing guns at those marijuana plants, but those are RFID tag sensors there to look at our marijuana tracking system. What's more important is where these dollars are going. So Department of Local Affairs was granted $6 million for unauthorized gray market grows. This was a little controversial, but the idea here is that we have law enforcement agencies walking into houses going, we don't know if this is legal or illegal or something else. Once again, gray market has nothing to do with people over 65 buying marijuana. I know it's a bit of a confusion for some people. The other thing that I like to point out here is that we also are spending considerable dollars on public health and safety. And so what I've done here is created a series of hyperlinks. I'm not going to go into them unless there are questions about it. But these are the high-level priorities that we have created within our state budget from the Marijuana Tax Cash Fund. If you haven't looked at the Marijuana Public Education Campaign, it's called Good to Know. It's remarkable. Once again, opponents and proponents of marijuana legalization sat together with Department of Public Health and advertising executives, as well as there's actually a youth member on that group that really looks at making sure that we're talking about marijuana in the terms that we want to talk about it. Drive high, get a DUI. What's next in your life? Do you want to, when you're 16 and you're planning on going to college, is choosing to use marijuana the best choice? You know, we're not trying to scare people, we're trying to educate people. On the next slide here, this is what is really exciting to me as a former social worker. I was going to say retired, but I can't afford to do that in my 30s. As a former social worker, though, we historically have underfunded these programs, and now we have $12 million going to school health professionals. We know in Colorado we have about an average of about a ratio of 500 students per school counselor. How do you fix problems that way? I mean, you're barely keeping up with your paperwork. Additionally, we have substance abuse prevention grants for local communities. Colorado is a local control state, so a lot of things are not done through the state. So what we've done with these dollars that we've said to localities, you come up with a solution and talk about the deficits and the programming you have for your human service needs, and then we'll create a grant program around that to make sure that we can meet those needs and then evaluate those things. Another example of that is the Tony Gramsci's Youth Services Program, which is also divvied out locally, but is a bipartisan board, a group of folks that decide how we fund after-school programming. We know the best way for youth prevention to actually occur is to make sure that our youth have something to do between the hours of 3 p.m. and 6 p.m., mostly when their parents get home from work, but after they've gotten out of school. So, so we've put money where our mouths are. Once again, in behavioral and substance use disorder, the one that I'll just mention here is the mental health crisis response system, that $4 million. We were putting people on mental health holds in jail. It's a violation of civil liberties, but we were doing it. Why? Because we didn't have enough places, enough beds, inpatient beds to put people on mental health holds. So I don't know how many people get better by going to jail when they have a psychotic break, but I'm guessing it's somewhere close to 0. And so now, once again, we put our money where our mouths are, and I've said in these rural areas where it's tough for people to get to a hospital, we're going to create some beds, we're going to create some opportunities. That has come from marijuana tax cash dollars. So what is next? I mean, this is why you're here. I mean, this is the elephant in the room, the big question. So we only did 38 bills with the word marijuana or cannabis in 2015 and 44 in 2016, a few fewer in 2017. So what is in store for 2018? We have a lot of unsolved questions. What are we going to do about public consumption? What are we going to do about the fact that we have the equivalent of liquor stores, but we don't have the equivalent of bars? What are we going to do about the fact that we know that kids with medical marijuana cards are still actually being discriminated against? These are the questions that we're still having to answer questions about. What do we do about the fact that as marijuana is still a Schedule I controlled substance in Colorado, if a child is born positive with THC in their system, regardless of whether or not a doctor has provided a legitimate recommendation to that mom, technically, in state law, Even though there's different guidance out there, technically in state law, that ostensibly counts as child abuse. So how many parents are getting stuck with that tag as a child abuser for doing something that their doctor has already recommended? These are the questions that we're going to have to answer. Fortunately, in Colorado, these have been bipartisan efforts. Unfortunately, the efforts to oppose them have also been bipartisan. And so it makes for some interesting conversations. But I'll just close on this. These are human stories for me. I'm not a marijuana user, but I don't discriminate against people who are at the same time. When a mom from another county came to my desk with her quadriplegic son, who had a marijuana patch about the size of a postage stamp on his wrist. And she said, Jonathan, my kid was kicked out of school the other day. He's got a 24-hour nurse. He's got a patch. He's got a trach tube. He's in a wheelchair. He's got muscle spasms and CP. What was he going to do that was going to create a disruptive environment? So we worked together, and we passed a law that basically said to our 178 school districts in a place where we believe in local control, you need to make sure that if your students have a legitimate medical marijuana recommendation, which is, by the way, non-smokable, that you make sure that those kids never have to choose between their right to their medication and their right to their education. So create a policy, or we're going to do one for you. And it's going to say that an adult caregiver can dispense this to a kid in a non-disruptive environment. And the reason I bring up this story is because, we believe in decorum at the state capitol. We don't applaud when bills come up. We don't boo. We don't cheer. We don't hiss. We save that for the campaigns. But when parent after parent after parent with kid after kid after kid showed up to the education committee to say, we understand you like local control, but let me tell you about my kid that I've had to put my life on hold for until forever, because he's got such debilitating seizures, we can't leave him alone. He's got cancer. He's got chronic wasting. He's got AIDS. We need this. We need to do it at school. The entire education committee stood up and applauded the parents after taking a unanimous vote to pass this bill. The bill ended up is now known as Jack's Law, named after Jack Split, the child who came to me with his mom to say that he was getting kicked out of school for a little patch on his wrist that was apparently going to lead to other kids ripping the patch off and licking it, because that sounds reasonable. Jack, actually, this is the anniversary of his death. He passed away just last year on August 24th. But everyone remembers him around the Capitol. Everybody remembers that smile, the look. He had a trach tube. He couldn't talk, but everyone knew what he was thinking. And those are the conversations that we can now have in Colorado and can have on a bipartisan basis. I carried that bill with the Republican Senate Majority Leader. These are the opportunities that we have, and these are some of the victories I wanted to share with you, because I hope that other states look at these successes that we've had and use this as a model, because this isn't red versus blue. This is about creating a better system for everyone. So thank you guys for your time. I look forward to questions.
Thank you so much. So we have not quite 10 minutes for questions. If you have a question, just raise your hand and we'll try to get to everybody. You, ma'am, in the back.
So, Representative, you brought up a topic that got me thinking about it being child abuse for a baby to test positive for THC, and should that be? But I think about alcohol being a legal substance, and a baby born while their mom's drinking, we have fetal alcohol syndrome, which creates such a huge burden on the medical side of things and social workers and everything else that we'll deal with as that child grows up. How do we find the balance of that smaller birth rates are known under marijuana, same cigarettes, it's not a good thing for you when they're pregnant. So how is a doctor legitimately prescribing something that is putting a child's future health at risk, and it not be something we're concerned about with the cost of public health and medical things that basically the burden on society to care for that person?
It's an excellent question. We'll have another breakout session on that. No, no. So I mean, my former world was working in a child protection office, and part of my job was to make decisions about the safety of kids, and then either go before a judge or a member of law enforcement and say, I don't feel that this kid is safe in this situation. We need to have them live with a relative. We have to put them in foster care. We have to create a safety plan around this. And what I would tell parents actually is, I don't care which drug you use, I care about how your use creates a dangerous environment for your kid. So a parent who goes home and has a margarita Monday and decides to have a margarita with dinner, I don't think the state of Colorado or a county in Colorado has a role to play in that unless mom is sharing that margarita with her 7-year-old and they're trying to keep up with each other. It's not an issue, right? And so what we tried to craft, and we've done this a couple of years now and have not succeeded, is to talk about how the substance use identifiably impairs that parent's ability to be a safe parent. We put a lot of pressure on moms, in this world. I mean, the fact that mom might get charged with child abuse, but that dad, who was aware of the situation, might not be. We're crossing gender, racial, all kinds of things. And so the way, what's even more complicated in Colorado is counties run human service departments, not the state. And so the way that we've been trying to do this is through good training of our frontline caseworkers to identify not the substance, but how the substance use actually affects that parent. If that parent was using prescription painkillers and had a valid recommendation from a physician that was aware of the pregnancy, County Department of Human Services would have nothing to say about that, even though that kid may be born addicted to opiates. It's a very tough conversation.
And Colorado Department of Public Health and Environment currently has a research study going on about the use of products in pregnancy. They actually had a breakout, I think it was either this morning or yesterday. Yesterday? Okay, so I would definitely check out their slides. And our Department of Public Health and Environment here is fantastic with answering questions from other states. So if you want to give me your card after or something, I can probably get it to the right person who's doing that study. So go ahead.
Well, first, thank you. I think you're one of the few speakers that I've heard here today actually talk about the equity side of cannabis regulation. And I was wondering if you could elaborate a bit, so kind of things that we are grappling with in California are broader equity considerations in smoke-free housing and the recriminalization based on that, even though it's technically a legal substance, on who's actually been having the economic benefits of the cannabis industry, where cannabis industries are being situated, so like a similar result from tobacco and alcohol where they're concentrated in low-income and communities of color. So I was wondering if you could elaborate on Colorado's experience and how you're...
I would say historically we haven't done a very good job. We haven't done a terrible job, but we haven't done a very good job. One of the interesting things that has come out is that actually for teen citations for marijuana use, so underage use, has actually, even though it's gone down overall, if you look at teens who are people of color, it's actually gone up. Now, why is the next question that we need to answer. And the other thing that we did is we have created a lot of barriers to market entry, market barriers to entry for people of color, for people with previous criminal records. One of the bills that we were successful in passing this year is creating a fast-track process for people who have committed crimes that would now be legal in Colorado to be able to seal their records. If that was really the crime, it wasn't violent, it wasn't aggravated, they weren't selling to kids, but then there's an opportunity for them to create a faster process to reclaim their lives and do something that the people of Colorado has claimed is constitutional. So it's the reason that we did this, there are good and bad reasons, I'll only give you the good one right now, is that we do have this sort of Damocles hanging over us from the federal government. You have these federal guidances, and when you go back and you call up, well, I don't call up Jeff Sessions, but if I wanted to, and say, but if you went back to the Obama administration and said, Cole or whoever, at Department of Justice, is Colorado hitting the mark? They go, oh, just refer back to the memo it basically means until we arrest people, you're okay. That's not a great way to do policy. It's one of the unfortunate things, and I think California actually has some good ideas, and Maryland has even been looking at this in terms of actually prioritizing people who have been victims of the drug war to give them a faster track. Because the last thing you want to do is take someone who's really good at the black market sales and say, you can never participate in the legal market, right? At the same time, if they're really good in black market sales, there are probably some of them you don't want participating in the legal market because they might want to continue doing that. And so how you ferret that out, frankly, I'm looking to California and other states for ideas on that.
Thank you.
Go ahead, Ms.
I'm from Arizona, where we narrowly defeated recreational marijuana. And during that campaign, it often following one another on the television would be a commercial that said, Colorado thinks it's horrible that they legalized marijuana, and Colorado thinks it's wonderful that they legalized marijuana. So that's one part of the question. The other part of the question is, the concern that I keep feeling is we're legalizing and then we're creating this tax revenue, and then that tax revenue is getting diverted. So were there any protections to keep the tax revenue where you wanted it to be? So I guess the first part is, what if that was true on those advertising, and how do you keep the tax revenues where the legislature intended them?
Yeah, no, actually my name recognition may have gone up in Arizona because I actually worked with a group of folks to correct the record on some things there, because they basically had ads in Arizona saying, we were told we would get money from schools and I haven't seen a dime.
And we didn't.
And in some districts that is true, but constitutionally, that first $40 million every year has to go to school construction. No questions, no doubt. We would be in court tomorrow. The remainder of the dollars is statutorily guided. The voters approved it, and I think we should hold faith with the voters to pay for the potential, effects of legalized marijuana. However, the law can be changed by the General Assembly, just like it can be changed by the people of Colorado. And yeah, I can't imagine being in Arizona. The accurate ad would have probably been that emoji that kind of goes like this. Kind of. It's the sky hasn't fallen. The streets aren't paved with gold. I mean, there are great things that we're doing with these dollars, but you compare that to the need that's out there. We're not solving all the problems. And even one of the unintended consequences, even though my school district has been successful in raising local tax revenue post marijuana taxes, you have a lot of people going, I thought marijuana was going to pay for this, why are you coming back? So the one thing that I do tell people is be accountable with your tax dollars. I tell people this because people want to invest their money in good programs. They just don't trust people like me. They don't trust lawmakers to do the right thing. So putting this in your general fund, apart from being bad fiscal policy, in my opinion, is also bad political policy. Because they're going, oh, that's just going to go to someone's pork barrel project. It's not going to really go to that thing. And I can go, no, look at our nonpartisan research staff that has said, here's where the dollars have gone. You decide.
And was there any supplantation of funding? Like you put some money in here and then we took it away out of the general fund?
What was interesting is as tobacco tax revenues have gone down, which is a good thing because it means less people are using tobacco. For example, the school bullying, anti-school bullying program and some of those other programs were funded through tobacco tax dollars. We backfilled those with marijuana tax dollars, and we hope those tobacco tax dollars don't come back, actually. And that's the other thing, is we created a tax that is not a sin tax. This is not to prevent use, it is to allow to pay for the things that we care about without driving a further black market.
We're butting up against the afternoon keynote, but if there are any other questions...
And I can stick around.
Yeah, we'll be up here for the next 5-10 minutes if anyone has any other questions, but thank you so much for your participation today. Thank you.
Serious.